Hi, my name is Samantha Vitale, and I am presenting my case study on a Division I collegiate swimmer with postural orthostatic tachycardia syndrome, or POTS for short. The following Level 4 rare case report examines a 21-year-old female Division I swimmer. The condition was made known during her yearly pre-participation examination when the athlete had a heart rate of 33 beats per minute and a blood pressure of 104/42. When first taking this athlete's blood pressure, it was noted that there was no movement in the needle and there was a complete absent sound of a diastolic and systolic beat. Her blood pressure is so low it's almost impossible to read or hear. The athlete stated that even automatic machines have trouble finding her blood pressure at times. Her low blood pressure typically causes her to faint, and she has no trouble breathing, but she experiences chest pains daily. Her symptoms are exaggerated by standing up too quickly or anytime she moves from a horizontal plane to a vertical plane. So before we dive into this case, I want to go over normative values of heart rate and blood pressure so we can better understand the difference between this athlete and normative values. So an average normal resting heart rate is anywhere between 60 to 100 beats per minute. This athlete has a resting heart rate of about 33 beats per minute, which is much lower than baseline figures. An average heart rate while exercising is anywhere between 100 to about 170 beats per minute. Although the athlete's exact exercising heart rate is unknown, she is aware that her heart rate decreases with exercise at times. Baseline blood pressure of most adults is around 120/80, and while exercising, this may increase slightly to around 160/80. For this athlete, her resting blood pressure is typically around 104/42, and hypotension is defined as a blood pressure lower than 90/60, so she's kind of around that hypotension range. And all these figures can be compared in Table 1.2, with the patient values being in orange. Normal resting values are in the lighter blue, and the dark blue represents the normal exercising values. So let's get into a little history of this athlete. When the athlete was only 3 years old, she had fainted while her mom was actually putting up her hair, and this resulted in a prolonged state of loss of consciousness. So she was unable to wake up from fainting until she was admitted into the ER, where she had a blood pressure of 45/20. She was seen by a cardiologist at the Children's Hospital of Pennsylvania, and there are no other family members that have this condition or any other related cardiac issues. However, her mom does have low blood pressure. Since the condition has affected this athlete since a very young age, there have been multiple tests done to confirm her diagnosis. The table tilt test is the gold standard for diagnosing patients with POTS, since this test is often used to evaluate the causes of unknown fainting by moving the patient from a horizontal plane to a vertical plane. The table tilt test came back positive after she fainted, which was to be expected after listening to the athlete describe what exacerbates her symptoms. This also goes for the stress test. So the average time a person lasts during a stress test is about 10 minutes, and this athlete only made it about 3 minutes before having to stop due to her symptoms. An echogram and an EKG were also used to rule out any other cardiac-related issues. The results of the echogram are unknown, and the EKG results came back abnormal. The athlete also has blood work done often during checkups with her cardiologist. Her original blood work came back with low levels of iron, magnesium, and potassium. The low iron found in her blood could be simply because she's a woman, and women are more likely to have an iron deficiency, but this could also be what is causing her irregular menstrual cycles. Down in Table 1.1, it shows the various testing that was done. It shows the sensitivity and specificity of each test, as well as the purpose and the results of each test. So from these tests, the athlete was diagnosed with postural orthostatic tachycardia syndrome, as well as hypotension and angina. So POTS is a condition that affects the way the blood flows through the body. Both the autonomic nervous system and the sympathetic nervous system are involved. POTS is a form of orthostatic intolerance, which is the development of symptoms such as lightheadedness, fainting, and a rapid increase in heartbeat when standing up too quickly. So, from this diagnosis, they decided to treat the signs and symptoms of this disease with medication, and they made lifestyle and diet changes to help manage her other symptoms. Unfortunately, there is no cure for POTS, but the prognosis is very positive. Many people can live near normal lives with this condition. They just have to make adaptations to help manage these symptoms. So the athlete was provided with a pharmaceutical intervention to help better manage these signs and symptoms. She's currently taking 10 milligrams of midodrine 3 times a day and 5 milligrams of nitroglycerin once a day. So midodrine is a fast-acting pure alpha vasoconstrictor that works by binding to the non-adrenal receptors, causing blood vessels to narrow. So the narrowing of the blood vessels helps to increase the patient's blood pressure. So typically this drug is prescribed to those with hypotension to help increase that blood pressure. Nitroglycerin is a vasodilator, which opens up the blood vessels to increase blood flow. So this medication technically contraindicates the effects of the other medication, but this one is used to help relieve her daily chest pains. She doesn't take it as often as the other one, so they don't outweigh each other too much. Diet changes can also be made to help manage the symptoms of those living with POTS. It's recommended for those living with this condition to increase their fluid intake, increase their sodium intake, and to eat fewer carbs. It's also recommended to eat smaller meals more often rather than fewer larger meals. And those with POTS to try to limit or completely eliminate alcohol and energy drinks from their diet. So this athlete's been living with this condition for her entire life. The main goal for this athlete was to decrease the symptoms to create a better quality of life. With the medication she's been prescribed, her symptoms have improved. However, they're not going to completely go away. Since there's no cure for this condition, she's learning how to live with it and how to better manage these symptoms. Her family is very supportive by helping the athlete with all these lifestyle and dietary changes. She's had this condition since she was very little, so her family has learned how to limit triggers and assist when these symptoms do arise. This athlete, however, doesn't make any goals pertaining to her Division I sport. She often struggles with seeing her teammates excel while she's limited in her training, which ultimately limits her improvement. So her condition doesn't affect her actual ability to swim, and no, she has never passed out in the pool. However, the athlete is limited in dry land and with weightlifting. She has no trouble in the pool, mostly due to the fact that she swims in a horizontal plane, but when she starts getting on dry land and she's in that vertical plane, she starts to struggle. So when weight training, she can not do any type of lifting, basically heavier than her body, so she's limited to only body weight training. She's unable to run, lift anything above her head, and she definitely cannot perform jumping jacks or burpees. So this leaves her somewhat stuck at the same level of performance, which has previously had an effect on her mental health and her participation with the team. She constantly sees her teammates improving and breaking personal records while she's struggling to keep up. So many people living with POTS can become frustrated, angry, annoyed, and even grieve over the things in life they were once able to do. When treatments are limited and patients struggle with maintaining a normal quality of life, so receiving a diagnosis of POTS can take time and it's often overlooked. Some symptoms may still be present even after the use of medication. And a decrease in participation of social or physical activities can lead to future problems such as depression and anxiety. So hopefully this athlete sticks with her sport and doesn't get discouraged too much because of her symptoms and the condition that she has. Because unfortunately there is no cure for POTS and treatment can only aim to decrease these symptoms. But thank you all for taking the time to listen to hopefully a new case study that you're unfamiliar with, and I hope you found this informational and have learned something new along the way.